Good evening. My name is Rosalind Santo Domingo, and tonight we will be talking about insomnia disorder. Ernest Hemingway said in his short story, A Clean, Well Lighted Place, he would lie in the bed and finally, with daylight, he would go to sleep. After all, he said to himself, it is probably only insomnia. Many must have it. So, what is insomnia? According to the updated DSM-5, insomnia is a sleep-wake disorder which makes it hard to fall asleep, stay asleep, or to be able to get back to sleep once you've woken up. In children, these symptoms may manifest in the absence of the intervention of a caregiver. There are two categories of insomnia. The first one is called the primary insomnia, wherein the difficulty in sleeping isn't connected to any health condition or substance abuse. And then there's also the second category, which is secondary insomnia, wherein the trouble in sleeping or staying asleep is caused by a health condition like asthma, depression, arthritis, cancer, or other mental illnesses, pain, life disturbance, substance use like alcohol, or substance abuse like drugs. So now that we know the two categories, we'll move on to the three types of insomnia. The first one is the acute insomnia. This type of insomnia usually lasts from 1 to 3 months as is most commonly referred to as adjustment insomnia or episodic insomnia. This type of insomnia usually occurs due to situational stress like having a new job, having deadlines, or having exams. After the person has adjusted to these stressors, the insomnia usually disappears. Then the second one is called the transient insomnia. This is almost similar to acute insomnia, and just that this type lasts for less than a week, sometimes like a few days. It is usually caused by changes in the sleep environment, sleeping patterns, stress, or depression. And then we have the last type of insomnia, which is called the chronic insomnia. As the name suggests, this type of insomnia persists for a long time and is usually associated with chronic medical and psychiatric conditions. Chronic insomnia can be categorized in two subtypes. The first one is persistent chronic insomnia, wherein the symptoms may last 3 months or longer. The second one is called recurring chronic insomnia, wherein the long period of insomnia may occur two or more times within the space of a year. So, how would you know if you have insomnia disorder or merely having trouble sleeping for the night because of extenuating circumstances? So, here are the symptoms of insomnia. First, you have sleep difficulty at least 3 nights per week. And then this usually happens despite adequate opportunity for sleep. Sometimes you have um, nights where you wake up several times, or just wake up too early and cannot go back to sleep. Another symptom is when you experience daytime fatigue, lack of energy, or sleepiness. You experience irritability, depression, or anxiety because you lack sleep, you have poor concentration, and memory problems. There are also increased number of errors or accidents, ongoing worries about sleeping, and frequent headache or acid reflux. So, who are at risk of insomnia? So, even though we say that this is a very common disorder, according to different studies, there are some group of people who are really more at risk of it. The first one is women. According to studies, women are more affected than men due to hormonal shifts or menopause. Insomnia is also more common during pregnancy. So after women, those who are more at risk are adults over 6 years old because of usual changes in sleeping habits, patterns, as well as health issues. the risk of insomnia increases with the age. And then another group of people are those with mental health disorder or physical health conditions. So having underlying health conditions can disrupt sleep and increases the risk of chronic insomnia. Also, people who have non-regular schedule, those who are working late night shifts or having shift rotations have more chance of having insomnia because their sleeping pattern is constantly changing. Also, we have stress people. So, stressful events can cause temporary insomnia. Sometimes, though, when it's like a major stress, it causes long lasting or chronic insomnia. So, how prevalent is insomnia actually when we say common? Well, according to various studies, insomnia disorder is very common worldwide with a prevalence of 10 to 30%. And in some areas, it can go up even up to 50 to 60%. It is noted that one of the most common cause of depression, impaired work performance, work or motor related accidents, and overall poor quality of life is insomnia. The thing is that even though it is easy to diagnose, it goes unrecognized most of the time because it usually happens with with comorbid conditions or other underlying physical health conditions. So, how do we treat insomnia or prevent it? Well, in terms of treatment, we have first non um, non-medication treatments, which are called cognitive behavioral therapy. So this may include sleep hygiene education, wherein um, they address behaviors that are incompatible with sleep, like um, taking caffeine before sleeping, alcohol use, watching TV right before sleeping, and other related things like that. And then there's also cognitive therapy, wherein correction of inaccurate beliefs about sleep are tackled. And the third one, we have relaxation therapy. The patient is taught to recognize and control tension or stress, which causes insomnia through a series of relaxation exercises. So another one is stimulus control therapy. This is a training wherein the patient associates the bed with sleepiness, which is also some type of classical conditioning, actually. And then there's also sleep restriction therapy, wherein the patient's time is in bed is initially limited, and then they keep on increasing it intermittently until optimal sleep duration is achieved. So, when cognitive behavioral therapy doesn't work, your doctor may also prescribe the following. So, sleeping pills, sedative hypnotic drugs, sedating antidepressants, and antihistamines. So, they use this to induce you into sleeping. Of course, this cannot be used like for long term, but for a few months at least, it will help you develop a sleeping habit. But the problem is that sometimes it can also be addictive. So we have to be careful about that. So for preventive measures, good sleep habits can beat insomnia for sure. So what are these good sleep habits? First is go to sleep at the same time each night and wake up at the same time each morning. Stop using your cell phones or ebooks before bed because their light won't allow you to sleep. It will awaken your mind actually. So, and then avoid caffeine, nicotine, and alcohol late in the day. Get regular exercise. So, what else? So, don't eat a heavy meal late in the day. Make your bedroom sleep inducing and comfortable as much as possible. Just use your bedroom for sleeping. Follow a relaxing routine before bed. And lastly, if you can't fall asleep, do something calming and train yourself to put concerns aside for the night. So with this treatments and preventive measures, we usually treat the insomnia disorder this way. And I hope that with this presentation, it could help you in case you're experiencing insomnia right now. So that's it for my presentation tonight. And thank you for watching. Have a good day.